Well, I'm sure that you guys are all. You always do that, don't you, Jordi? Okay. Thank you. No, I'm sure that you are all so pleased as we are here. I think we have had a unique opportunity to enjoy really good knowledge and really innovation during the session this morning. It was stated in the program, our main goal, and yesterday when we were actually reviewing how networking can help in building capacity, how health technology assessment is important for decision making, for coverage, for baskets. We were talking about all these issues that, to be honest, we were very, very eager to discuss, but actually we have discussed them times and times and times and again, because it's part of our core business. And at least for the Spanish network, the commitment to get patients involved and to actually reach a partnership is there, is strong. We have already talked about the experiences we have, but actually we have a long road to walk, right? And as I said, it was explicit from the beginning that we actually wanted to have this part of the conference because we wanted to learn. And I think it has been really, really very useful for us to hear about all the experiences. The Canadian one, definitely very educating. How you guys in the patient association and empowerment side are actually building a capacity that is amazing, and I'm sure that we can help each other in making it more useful and more visible, because I don't know to what extent to the common knowledge, not to the very specific bodies, but to the common knowledge of the health technology assessment crew, I think there's still room for dissemination of all this amazing work you are doing, guys, and we definitely need you. So some of the lessons that I extracted, and that's a personal summary, we need to build a partnership, and that should be there. It should be continuous. And we need to educate each other with that relationship. And we definitely need economy of efforts. That's something that I really would like to discuss further during the lunch, which is what's the difference between something I really like it very much. We need evidence from the patient side. And so we need to be able to build this evidence and use this evidence. And that to me is very different from patient advocacy. And probably that's, another line of work we need to deploy. In Spain, we have a very developed, I would say, patient advocacy network. We don't have so much of the bringing evidence from the patient side to the table. So I think that's an open line for us that we definitely need to work on. And I lost my notes. Sorry, it's the digital device. And probably the other important lesson I think I would like to highlight is that this definitely is a transforming trip. Kind of, I think, the way health technology assessment is done, and we have some examples today about EMA or CAD. The way you approach health technology assessment, the way you approach decisions change when you actually start working on that. So let's make sure we are ready for this transformation, not only educating ourselves, but making sure that we are ready to transfer the system. I think it's for the best. And also, I think it's transforming on the other side, because otherwise it would never work. We work together, so actually, as I was saying, the role of the patient strengthened, put in their place, supported. I take your point perfectly, Tapas. I think it would also change the ability of the patient to behave as a citizen, which at the end of the day is probably what we are talking about. It's not the same, and it has been discussed extensively. But one of the things I see as a vindication from the patient organization side is, yes, we are citizens with a certain condition, so we want to play this role. Well, let's work together and see where we get. It seems a very interesting journey. On our side, I think we are ready to take it. I would like to only add a note of concern I got myself, which is this business of finding patients. And that's a major one, isn't it? And I don't think we have heard many solutions, like real solutions, but a lot of open roads to actually get there. So, well, let's see. Let's work together. That's my summary. Paloma, what do you want to add?
Thank you, Sandra. No, a little bit things to add. Only to thank the organization, first of all, and to thank you for being here, and thank you for your questions, and for being on the other side. Hello to those who are watching us in streaming, because we know this is very difficult. Not being here. More than 400 people.
That's the statistics they gave me this morning. I was really surprised.
Very successful.
200 in Spanish, 200 in English, more or less. Give or take.
So yes, this has been a very, very successful conference, and with the opportunity to do an in-depth review of all the experiences that we have, but also the big challenges we have in front of us. We've been discussing about such an essential item that is the patient's and citizen participation on HTA process. And of course, all we are aware that this is essential because HTA recommendations will affect at the end patients and of course citizens and system and every one of us. So this is an important thing for patients, but this is actually an important thing for regulators and for HTA bodies and for experts. So this is because not only for the impact, for the social and economic impact, but because if we don't take into account the patient experience, we probably will be missing something. Because patients have a unique knowledge and experience and a perspective, many unique different perspectives that we are missing. And if we don't take into account, as I've said before, patients are experts in their disease, and not on the disease exactly, but on the experience of the diseases. But this is a big challenge to train patients in order that they'll be prepared to provide their really valuable experience on their diseases and to have a very, very valuable contribution on HTA assessment. So it's in order to assure not only that this experience is taken into account, but also their needs, their preferences, their values, their expectations, isn't it? So this is a very, very, very big challenge we have in front of us. But we are taking steps forward. We all know that we're on the way, and we're taking a step forward. We're developing procedures, and we have many previous experience. We have different experience, different perspectives. We're training technicians, we're building capacity and on how to engage patients, and we are actually on the way. Because after 10 years of experience working together in our Spanish network of HTA, this is time to put on reality what we have discussed previously, all we have learned today and yesterday, and this is time to put on reality and to little by little, step by step, put it on the ground, all we have written on protocols. So we think that we strongly think that efforts can be done, and we're going to do the effort. We're going to do this step by step because we are convinced that although this could be very, very time consuming, this is worthy for all, and this is without a doubt a necessary investment for the future. In order to this is not a gratuity. This is just for the improvement, for the quality improvement, and in order to maintain equity, cohesion, the legitimacy and fairness, and eventually in order to improve the quality of life of people, citizens, career, and all of us, and to maintain the system. So thank you, Sandra, thank you, all of you, and see you soon. I hope you see you soon, showing the real experiences that we have in all our organizations.
Mm-hmm. Thank you very much. Well, if I may now, I would like to extend the acknowledgements and the gratitude, definitely to the translators. Apparently they have done a great job. I haven't used it, but I've heard so. But also to our team here at the Institute. Many of you have been interacting with them, and especially, I mean, it's all the team that has been putting forward a lot of work for the logistics and for the contents and for the contacts with all of you and organizing the thing. And particularly, and just as a representation of the rest of the team, I would like to thank, and I ask you for an applause for them, to Maria, Vicente, and Maria Bono, that have been actually leading the team that was able to build all this conference we have.